Hi, Data Bites. Lena and Holly here, the Data Girls. We're so excited to have another Flash Friday. It's been a long time. We are back again at it. We're excited that we're able to do a little bit on our passion, which is data and technology.
Mhm.
And today we're discussing AI in the healthcare sector.
Yes.
This is a big deal. We live in Nashville, Tennessee. This is where AI and healthcare meet.
Right.
So today we're gonna just kind of go in a little bit about some of the new and improved things that are going on with AI related healthcare and
Mhm.
some things that we're learning and excited about. A couple of things we can start off talking about is how in medicine diagnostics are running differently with AI, right?
Mhm.
There are AI algorithms allowing an increasing accuracy in terms of that speed of it, all of it, from this MRIs, the CT scans, you name it. AI is creating even more dynamic algorithms that can help us get to the meat and potatoes of what's happening in terms of humanity and disease.
Mhm.
So some of those areas that we see that in is radiology, pathology, early diagnostic. Listen, if we can get up in here and see what is
Mhm.
going on early and detect early, let's go. So a huge component of AI is kind of figuring that what's going on early, right?
Mhm.
Um, Even personalized medicine. When were we able to do that ever?
Yeah, that's a big one, I think.
Mm-hmm. So in personalized medicine, they have everything from developed treatments plans per person. Now, mind you, it has not been that way. And as a Black woman in America, I can tell you my body type is not everybody else's.
Mhm. Mhm.
My body type ain't most people's. So, like, things that may apply to me will definitely not apply to everybody else, and vice versa. So, having these things really does help. We
Yeah.
have to look at medicine as the person as a whole, not as a whole community, because that's not how that works, right? So
Yeah.
drug discovery, some of these things are big in terms of um, personalized medication and the way AI is going in that regard. Holly, do you have anything you want to add to that?
Yeah, I think one of my favorite applications of AI in healthcare is probably like you were talking about that early detection types of software. And I remember this was probably 2 to 3 years ago now, but they had come out with a software that could detect cancerous tumors earlier and more accurately than even, just sending it to the doctor to check out your scans. And so because they had developed the algorithm via looking at all of these different scans that were cancerous and then ones that were not. And then after a while, the algorithm was able to determine, hey, this one right here looks cancerous, this one does not. And actually, it really helped a lot as far as like catching things much earlier and then thereby improving outcomes for the patient. And so there's so many different, like you were saying, so many different applications of this. And in Nashville specifically, that it's a huge healthcare town, and there's a lot of different applications kind of being rolled out here as well. And so I think personally, it's I see more pros than cons on this one because of just the power of increased patient care, increased early detection, increased support for our caregivers and healthcare professionals. So I'm all for it.
Right. I helped stood up a data science center at
Mhm.
Meharry Medical College, and we created a data lake for Metro General Hospital at the time. And what we were doing was utilizing predictive analytics with AI.
Mhm.
And we were doing so because we were able to predict outcomes accurately based on numbers, right? So based on, individualized patient data, we
Yeah.
were able to kind of pinpoint hospital readmission real time. That is a big deal, like a huge deal. So AI tools can analyze patient records They can see and predict whether this person will be discharged or readmitted at any point based on the pattern that they see. And again, when you have big data now, and you have the ability to look at large population subsets, you can almost guarantee, hey, this is the ending of that. So even with disease progression, AI has been very useful in how it manages the disease or how it can identify the process of the disease based on all of the different people who've had said disease before.
Mm-hmm.
So we ain't even gotten to the surgical part. But being completely transparent, it is very important for us to understand the processes that happen. And yes, there are bad things that can happen with AI. We are not disputing that. In our last podcast, we discussed in depth about deep fakes and some of the other, situations that happen because AI is available to everybody. But with that being said, it still is doing a lot in terms of robotics and surgery. It is still doing a lot in terms of surgical planning, virtual health assistants. Let's be clear. A lot of us think that we know more than, say, our doctors. We don't. But some of these AI and how some of the AI virtual assistants have a wealth of information as if they are doctors.
Mm-hmm.
And it allows for them to give you more information right away 24/7. So you don't have to wait for your doctor to get there, and you can get more in depth to what your specific situation is. So telemedicine has always been a big deal, but now that an AI driven platform that allows it to be even more robust, even in the mental health space. So kind of learning and understanding how these things can help us is very, very important. One last aspect that we'll talk about and we'll let it go. Brain computer interfaces. Have y'all heard of that? Holly, you heard that?
I have recently.
Yeah, yeah. So we know Elon Musk
Mm-hmm.
loves to be at the forefront of everything that's technologically sound.
Mm-hmm.
Um, and he has I think a dynamic group who's doing it. What is, I can't remember the name. How do you remember? I think it's
The
Neuralink.
company
Mm-hmm.
early.
But there are so many other companies doing this as well. But it's important because what they're doing is really helping to restore mobility for patients who are in paralysis. That's huge, y'all. Because with this BCI or brain computer interfaces, I'll just say BCI from here on out, they're able to kind of help your brain along by
Mm-hmm.
embedding kind of a chip or different things. There's different ways of going about this, but at the end of the day, it's the same idea. You're able to stimulate the spinal cord, things like that. These are new and improved ways to use technology and AI to help further medicine as we know it. What are your thoughts on that, Holly?
Yeah, I think like if any of you grew up watching like Star Trek and all those things, it's like, okay, the future is here. Like we can control things with our brains now, and I think that that also can work the other way too. It's like, yes, you can control, like say, like you were talking about people who are paralyzed, being able to control the instruments that help them speak or help them move via their brain. But also, I think there's a wealth of data to be gathered by having these type of BCIs where there's an implant in someone's brain, and now you're able to really get real-time information, maybe even without them being in the hospital, right? They can be at home. This is just, you can just you're collecting data all the time on what their brain is doing and whether something's going on, what's going on. Is it malfunctioning? Is it functioning correctly? So it's going both ways, and I think that's something that's pretty exciting. And I know that that's one of the things that people are kind of like, do I want things in my brain? I don't know, but I mean, there's always going to be pros and cons to it. I think that um, in kind of the examples that we talked about, there's a lot of pros there.
Mm-hmm. So, I mean, yeah, there are a lot of pros and
Mhm.
there's a lot of cons, but like I'm gonna say it, if I have epilepsy or Parkinson's disease, I'm gonna try something. I'm just like let's
Sign
put it
me up.
where it is, y'all. Like this is something that stroke rehabilitation. I have a family member who is dealing with that right now. this he can't speak anymore. But he is very much cognizant of what is going on around him. That
Yeah.
is not at all what we need out here, y'all. But
Yeah.
AI is here and it's doing a lot of things. The tools that are coming from the BCIs are helping tremendously. Yes, it can be invasive, but like your body's already been invaded.
Yeah.
If this is something that you're are dealing with on a regular basis, I'm pretty sure you would be happy to be able to say something.
Yeah.
So again, in the cognitive enhancement, there are individuals who are doing memory implants, attention and focus for the ADHD community. Um, these things are all locked in, like they're all together with the with what's going on with everybody and how they're developing tools with BCIs. Anything else you want to add to that, Holly?
No, I think
Mhm.
I think that's right. I mean, I know that there's so many more applications that have been developed and are being developed, but yeah, I think it's definitely pretty exciting to see what's coming out and how people have been able to be creative and use AI to, improve people's lives. So,
I mean, hey, we're on the cutting edge of innovation on this, guys.
right.
This is something we have never seen in our lifetimes yet, and it's coming to fruition. So yeah, we wanted to be here to talk to you about what's new and improved, guys. If there's something you guys want to hear us talk about or discuss, we are open to that. We are thankful to have you here, and we want to support you in any way we can. We have a community forum that we deal with. We go on lives often on Instagram and TikTok. Holly, what are our handles for that?
All right, you all can contact us on Instagram and TikTok at the Data Girls, Data Girls, and we will be on live on Fridays and we will have our podcast posted. So we are looking forward to connecting with you all there. Please feel free to follow us and tag us and ask any questions that you'd like on those platforms.
All right. See you soon.